Hey everybody, so I'm coming here today just to tell you guys a little more about what happened with me yesterday. My clinic called and pretty much it just set me over the edge. I got a call from the office and the girl just said who she was and that she was calling, just to tell me that my insurance had been kicking back some of the claims. Y'all forgive my big hair poof of sorts. I'm really not feeling that great, but I wanted to be able to get on here to tell you guys exactly about what happened. So she said who she was and was saying that, the insurance had been kicking back my claims of sorts and all that. And I told her, yeah, I'm aware of it. I've already received paper bills in the mail from your clinic. And so, it's in the works with them working on getting everything resolved so that they can, resolve my claims and all. So then she goes, oh, well, have you spoken to them recently? Blah, 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 because your balance is this much and all this. And, I just don't want the account to go into 90 days past due or anything like that, yada, yada. Mind y'all, I just started seeing this new clinic like 3 weeks ago. Well, now it will be 4 weeks because I started seeing them the week of, right before Thanksgiving, like a couple of days before Thanksgiving. So, essentially when they probably started billing things, it's been like 3 weeks. So anyway, so she said that, and I told her, that I had been talking with them to try to get it resolved, and that I would go ahead and give them another call just to be sure that they were doing what they were supposed to do to get things resolved. But y'all, that phone call completely just set me off. I couldn't even believe that they were even calling to tell me that. And I'm like, you've already sent me paper bills. And actually, I got an explanation of benefits from the insurance company first before I even got a bill from the doctor's office. So that's how I know that the insurance, still wasn't processing it the way that they should have, because I was looking at the explanation of benefits and seeing how it wasn't correct. So like I said, y'all, it just set me off over the edge. And so I decided to write an email while I was on hold for an hour just to speak with someone from my insurance company yesterday. I put together an email that I'm going to share with you guys. I sent the email to the physician himself, as well as the same one of the kind of clerical administrative girls or whatever that had sent me emails before, so that way everybody would be able to have access to my thoughts in this letter. So here it goes. I say, good afternoon. My name is Monica. I write to you today in efforts to share my perspective/experience within your practice with whomever is reading, as well as your fellow colleagues and staff. My hopes are that by sharing this, it will allow your practice to thrive in caring for struggling infertile couples like us. I've contemplated putting together my thoughts previously, but as of today, my frustration, grief, and overall desperation has driven me to share my thoughts. What's resonated from the beginning is how during my first consultation visit with Dr. such and such, and our discussions about my history, his effort in minimizing my experience with my cervical ectopic pregnancy, which was a result from a previous IVF cycle at another clinic. My stating that we terminated this cervical ectopic at 8 weeks gestation to save my life obviously wasn't accurate. It was an ectopic that wasn't viable, he said. Does this somehow lessen the pain and anguish that I've experienced trying to correct me about having a potassium chloride injection pushed into my wiggling child with a perfectly beating heart only to make it stop beating? Is this not terminating a life, albeit for viability reasons? Is losing a child or pregnancy loss only pertinent or grievable when it's considered clinically viable? The next occurrence came at being interrogated about my previous SIS all while I'm writhing in absolute pain on a table during my HSG. I'm trying to focus on breathing and consoling myself, shaking uncontrollably, much less answering questions about an exam from a year prior. Then being asked if I had had a previous cesarean section. Is this physician familiar with a patient's history prior to a procedure / encounter not a thing anymore? My confidence was dwindling by the second at that point. I feel as though my case of a medicated cycle may not be a profitable one at this point in comparison to IVF, to the point where my estradiol levels were, I guess, sufficient enough to trigger at 49. No closer observation to whether I'd even had mature growth from my ovary on the side that demonstrated to be patent was attempted. Seeking fertility treatment is about giving the best odds you have with what you have. From that, I'll move on. As I sit here typing this with puffy eyes and tears flowing down my face, I can't describe how much more beaten down and defeated I feel in my journey after my experience with this practice. I will say, I, as a licensed healthcare professional myself, know firsthand that healthcare is in fact a business, a for-profit one at that. As a fertility clinic, and knowing how high emotions run in a couple's struggle to become parents, I am appalled yet saddened with the blatant emphasis on the monetary aspect from your staff. The first part of this comes from receiving a call the day before our scheduled IUI to remind us that we have to pay out of pocket because our insurance didn't cover the insemination. The second part comes from your office calling us to tell us how much our balance is after our insurance carrier kicked back claims due to having another primary on file. This, in fact, I spent 2 hours on the phone to resolve before I even scheduled my first appointment with your office. I have since receiving an explanation of benefits been trying to have all this corrected before your office even called or sent the first bill in the mail for your services. The third part is after a whole week of several excuses or fabricated ones that I perceive. I finally received an email with the estimated cost for 3 mini IVF cycles with genetic testing, a whopping $19,100. The attachment didn't even break down what the individual costs were. Just a PDF document list of procedures with a total at the bottom. Why not just list the charges so that in case the couple strikes it lucky and gets normal embryos the first round, their journey and financial burden could possibly end there. This email mentions nothing regarding a guarantee of any sort or even a return of funds if the first or second cycle becomes successful. The only mention is that the balance of $19,000 must be paid in full at your first teaching appointment, and it doesn't include the cost of medications, monitoring, or blood work. Upon contacting me regarding my balance today, I wasn't even asked, "How are you today?" Not even whether I had become pregnant from my recent medicated cycle, whether I wanted to pursue any further treatment, make another appointment, or if I needed any additional information / resources to continue my quest in becoming a mother. No, why? Because the premise was in regards to money. I am not an account number. I am not a balance with a telephone number listed. I am a person struggling with infertility. For Christ's sake, whether you are a Christian or not, is having compassion that far-fetched of a concept in the business of making money? I do it all the time, whether I'm holding a patient's hand at the bedside, taking their last breath, treating my patient's cocaine-induced angina, or listening to a 90-year-old talking about her cat's arthritis for the 7th time. It's doable. All of this not only adds to my grief of being infertile, it makes me feel inferior. I understand my struggles and pain don't impact you or your staff. These are my shitty circumstances to bear. I have been dealt a messed up deck of cards in my life. It is my responsibility to find the hand from that deck that becomes the game changer for us. Moving forward, I hope my words to you foster an environment for your staff to treat your future patients with dignity, respect for their feelings, and respect for their heart-wrenching efforts in battling infertility to have a family. In close, I want you all to know that yes, I've just spent another 2 hours on the phone with my insurance company writing this. Yes, they're reprocessing the claims. I'll get you your money for services rendered, or rather, in my mind, the unfortunate disservice I have encountered. Your time and attention in reading my thoughts are greatly appreciated, regardless of whether I feel valued or not as a patient. Happy holidays to you and yours. Signed, Reproductive Misfit. Well, I'll tell y'all too that maybe a couple of hours after I sent this email, lo and behold, the office calls me again. Of course, at this point, I'm still in my feelings and everything of sorts, so I don't even bother answering the phone. I just send them to voicemail. And now what I'm going to do is I want to play for you guys the email. I'm sorry, not the email. The voicemail that the doctor left. Let me get to it. Okay. All right, so here it goes.
Lineups Fertility Institute. I'm calling you about the message I received, and I'm very sorry that you're upset about the care you received. If you could give me a call on my phone, I'd be happy to talk to you. And that number is, you can call me anytime. I'm just getting things completed here in my office. Or if you prefer to set a face-to-face appointment, feel free to do so. And I'd like to answer some of your questions and comments. Hope you're doing well. I'll talk to you later. Bye-bye.
So I hope you guys were able to hear that. Pretty much what he said was, in the start of the call was, he says that, sorry, I got a little bit of dry mouth. He says, I'm sorry that you're upset with the care that you've received. I know some people might feel like I'm kind of nitpicking or trying to pick apart his words or message of sorts, but I guess for me, and even in my career, what I do every day, that's not a way for you to, of sorts, call yourself apologizing to someone. And, saying, I'm sorry you're upset. That's not, my lips are like mad dry, y'all. But, that's not, taking any kind of, responsibility of sorts from, or for, what's happened. You're not trying to be accountable or even acknowledging that you or your staff have really done anything wrong. And I've learned, like I said, at my job, we always apologize for things, whether or not we feel like we're really at fault or accountable at all for the reason why someone is upset about something. We still, just say, hey, I'm sorry that we've upset you. I apologize that, we've dropped the ball or we didn't do X, Y, and Z. But aside from that, like I said, of course, in my heart, my mind, I don't feel like they're sorry at all for any reason. He just, of course feels some type of way that I've put to paper of sorts, how I've been treated in my encounter, from this whole, 3 weeks, really I've only had direct contact with them for like 2 weeks. So in that short 2 week time span, really how much, damage you could have done on or impacted on just one patient in that short amount of time. And so I don't feel, of course, like they're sorry at all. And of course, I'm not gonna. It's a 40-minute drive for me to go to their office. Of course, I'm not gonna take, that's 40 minutes one way. So I'm not gonna take 40 minutes or over an hour and 15 minutes to drive there and back to have a discussion with them. No, I feel like if anything, if you want to address anything that I've mentioned, he could have very well just emailed me back from his personal email, because like I said, I sent it to him as well, as one of the other like administrative staff or whoever the person is. So and then too, I guess maybe the tone of my letter, maybe I wasn't specific enough to tell them, I'm not looking for answers to my questions. They're rhetorical questions. I'm putting them out there, so that these are things that you can use as a learning experience, a teaching moment is how I would kind of categorize it as. I mean, you share that with your staff so that moving on, caring for other patients, him as well as his staff, just be more mindful about the things that they say and how they do things. Because obviously my case was very poorly managed. Because like I said, I was being facetious when I mentioned my estradiol being 49. I think I mentioned in one of my previous videos about that. Because that was my initial estradiol, and they never bothered to check it after then to even have a measure of, if I had any mature follicles in there. Because the last time they had saw my ovaries, I had a 12 and a 13 on each side. And that was on day 10 of my cycle. And, he was asking me to trigger 4 days later, and which was that following Tuesday. And again, like I mentioned in the email, being that I did the HSG, and per the procedure, I only have one patent tube at this point. So you didn't even investigate further after that to see that I even had a dominant follicle on the side that was patent, to even, validate it, me even taking a trigger shot, or if it was even feasible that I'd get pregnant that cycle. Does that make sense to y'all? Because I could have very well, that doesn't mean that automatically still all 4 of those follicles became mature ones. They had no measure. They had no ultrasound to confirm it, nor did they have any blood work to even demonstrate whether I had any mature follicles whatsoever. So, like I said, my case was just poorly managed. I didn't go get any cycle day 21 labs drawn. I didn't bother, because as things were just unfolding, you guys that have been dealing with infertility this long know that I just knew that this cycle was going to be botched. It was just not going to work. Because things weren't going as they should have, and things were falling through the cracks. And so I just knew that it just wasn't, it wasn't going to be a successful cycle at all. So yeah, I just want to get on here to show you guys, to tell you guys about all that. Sorry about, the length of the video. You guys comment down below if you have any information to offer. But I do have a pending appointment with my, a third new RE coming up in January. So, but leave comments down below and just let me know what you guys think about it, and any other suggestions of that sort. That way, we'll be able to share some thoughts, so that way I can carry any new information forward, seeing my new RE. Even though I think at this point I've got it down pretty well. As far as, what we need to do from here. So, again, thank you guys for watching so much. Don't forget to comment, like, subscribe, and make sure you can get over to my Instagram and follow me on there, because sometimes I have updates on there for things that I don't necessarily haven't shared on this side on YouTube. So, again, thanks for watching, and I'll see you guys later.